Hello, and welcome everyone to today's webinar, From Under the Radar to All the Rage, Family Resource Centers and Family Resource Center Networks. My name is Robin Shemwell, and I am the Project and Communications Manager for the National Family Support Network, and I will be presenting today's webinar. I would like to start by finding out who's in the room today. So we're going to launch a poll, and we would love for you to let us know on that screen that's popping up, or the little box that's popping up on your screen, where are you joining us from? And if you are joining us from someplace other than the regions listed, let us know in the chat where you're joining us from. All right, so looks like we have about a quarter of the folks from the Northeast, some folks from the South, almost half represented from the West Coast, and then about 20% from the Midwest, like me. All right, and then we have one other poll that we are going to launch. We would love to know, what's your affiliation? Are you working with a family resource center directly? Maybe you are a parent leader, perhaps working in government or education. Thank you all for being here today. We'll give just a few more seconds to answer this poll, and then we'll take a look at the results. All right, let's see what we have. Okay, so we are mostly represented over halfway with representatives of family resource centers, some network level folks as well, government agencies. Welcome everyone. Thank you so much again for being here today. Today, during our time together, we are going to review family resource centers. We're going to give an overview of family resource center networks, give an overview of the National Family Support Network, and then provide you with information on NFSN resources and opportunities. So jumping right in with family resource centers, the concept of family support dates back to the late 1800s with the creation of settlement houses in major metropolitan areas such as New York, Boston, Chicago, and San Francisco. Settlement houses provided the large number of immigrants entering the country at that time with support, job training, English classes, and social advocacy as means to assist them in understanding, adapting to, and succeeding in American society. This slide illustrates the Good Samaritan Settlement House in San Francisco on the left from 1913, and on the right, its modern look is the Good Samaritan Family Resource Center that continues to serve families today. Originally serving immigrants from Europe, Good Samaritan has evolved with the changing community needs and shifts in the neighborhood population into a family resource center serving the Latino community. Thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as America's best kept secret. A family resource center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of a family resource center in Vermont, or they may be school-based, like the image that you see on the right from Kentucky. They may be in rural settings, like the image you see on the left from Colorado, or in an urban setting, like the image on the right of a family resource center in the Bronx in New York City. Wherever they are, FRCs work with families with an approach that is not only two-generational, but multi-generational, strengths-based, and family-centered. Each of these concepts is important. Perhaps you've heard of two-generational or two-gen work. Well, family support is the original, not just two-gen, but multi-generational work, as programs work with children, parents, and grandparents as well. They're strengths-based because we see families as having strengths that we want to support them to build upon. And they are family-centered because everything we do has families at the center. They are designed for all families, not only low income or highly challenged ones. So the support they provide is non-stigmatized, making it more readily accessible. Programming is provided at no cost or low cost for participants. The image to the right is of a Family Success Center in New Jersey. There are 57 Family Success Centers across the state's 21 counties. Each county has at least one, and typically more than one Family Success Center. That includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for two of the most important roles we can have as adults: being parents and being spouses or partners. Two of the most important roles we have, for which we typically receive no support or training. Hence the value of universal access to FRCs. Now we're going to launch another poll here related to the Strengthening Families Protective Factors, but I also did just want to mention for our folks online today that the resources that you see here, including the PowerPoint, will be shared with you and will be available after the webinar on the NFSN website. As well, I also wanted to mention that we will have a Q&A at the end of this session, so hold on to those questions and we will answer those at the end, or you can input those. And then we also do have tech in the room. So feel free to drop any tech questions in the chat that you might have, as Felipe has already been sending links out to folks. And did also want to mention for folks that everyone on today's webinar is muted. And again, you can put your information in or your questions in the chat. All right, so again, we're going to jump right into the Strengthening Families Protective Factors, and we've launched a poll and would like to know, how familiar are you with the Strengthening Families Protective Factors? Give a couple more seconds here and then find out. All right, so of the folks in the room, we do have a good amount that are pretty familiar and very familiar with the Strengthening Families Protective Factors. For those of you who aren't as familiar, the Strengthening Family Protective Factors come from the Center for the Study of Social Policy. Research has shown that these 5 protective factors increase family stability, enhance child development, and reduce child abuse and neglect. So as we're working with families, we want to support them to build these protective factors because we know that they make a positive difference. And those protective factors are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and social and emotional competence of children. We encourage you to find more information on the CSSP website if you're interested to know more about these protective factors. There is no dedicated federal funding for FRCs, unlike Head Start, home visiting, or after-school programs. Yet, there are now more than 3,000 of them working with more than 2 million people annually. So why are so many public and private funders at the state, county, city, and community levels choosing to invest in FRCs? Simply put, FRCs are just a good idea. They're cost effective. They're highly adaptable for various communities, be they urban, rural, or ethnic, and have demonstrated successful outcomes through multiple external evaluations. As conveniently located hubs, they bundle and co-locate many services that may be familiar to you, such as home visiting, evidence-based parenting education, health screenings, play groups, fatherhood programs, family counseling, and food banks. Because FRCs are shaped by and responsive to their communities, we often say, if you have seen one FRC, you've seen one FRCs. Families are engaged in shaping the programs. Staff that are hired represent and share the lived experience and the diversity of the families served, and parent advisory committees impact program development and implementation. At the same time, despite their organic development, there is remarkable similarity in their most common service areas. This data on the screen comes from a national study funded by the Robert Wood Johnson Foundation that the NFSN worked with a research institute to conduct. Parenting support exists on a continuum from a lighter touch to more intensive services. So we start with parenting workshops as one example, moving through the spectrum to more intensive services such as home visiting. Access to resources also exists on a continuum from a lighter touch to more intensive services, starting with enhanced information and referral, moving across the spectrum again to a heavier touch such as co-location of resources, such as the home visiting or fatherhood programs that we discussed on the last slide. Concrete supports directly provided at the program, such as clothing, food, and rental assistance as well. FRCs not only provide programs, but build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. So now we would love to hear from a parent. We're going to hear from Sheila from an FRC in Corning, New York.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. You could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax. And it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life, regardless of anyone's socioeconomic status, regardless of racial background, educational level. The need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, it's just, it's like a domino effect.
So now that we have talked about FRCs and I've had a chance to describe them, I'd like to launch another poll, my final poll, and ask if you have seen programs that look like family resource centers in your state. Right, let's find out. All right, 94% said yes, you recognize what you've seen as a family resource center in your state. And we have some folks who haven't or are unsure. So let's take a look at some examples of family resource centers. So two of the things families have been seeking support for during the pandemic and since were parenting support and access to resources. And those happen to be the bread and butter services of any FRC, be it urban, rural, school-based, or community-based. So FRCs more than rolled up their sleeves to help support families through the crisis. These photos illustrate some examples, such as drive-by shows of support for families in Kentucky, infant supply distribution in Colorado, and a virtual bilingual story time in Massachusetts. In Kentucky, the school-based FRCs took on delivery of free lunches to students while the schools themselves were closed. Some examples of progress to date include investments in FRC network infrastructure in Hawaii, North Carolina, and Texas. There are deeper investments in family resource centers across states in Arizona, Florida, Georgia, expanding the US, going all the way to West Virginia. New networks have been established in Minnesota, Nebraska, Oregon, and Wyoming in just the last couple of years. And first-time investments in FRCs have been made in Kansas, Michigan, South Carolina, Virginia, and Washington. This slide, developed in partnership with Casey Family Programs, which is one of the NFSN's national partners, illustrates how family resource centers work with families across the continuum of potential involvement in the child welfare system. For every $1 invested in family resource centers, the state of Alabama received $4.93 in immediate and long-term consequential financial benefits. Neighborhoods with family support centers had a 26% lower rate of child abuse and neglect investigations than similar neighborhoods without them. A University of Chicago, this is from a University of Chicago study. And Teller County, Colorado is a semi-rural county outside of Colorado Springs. Since their human services agency moved to a differential response system in 2016, referring screened out families to participate in FRC services on a voluntary basis, they have seen a 63% drop in their child abuse rate, and they only have one FRC in the entire county. Think of not only the huge cost savings, but the human cost savings. So many families that are now spared entry into a highly traumatizing system that no family wants to have anything to do with. And once you're in, you may never get out of. The latest data comes from research studies supported by Casey Family Programs that illustrate the specific child welfare system cost savings, both in semi-rural Teller County and urban Orange County, California. In Colorado, families who participated in family resource centers demonstrated statistically significant improvements in economic self-sufficiency, health, concrete support in times of need, social support, family functioning and resiliency, and caregiver child nurturing and attachment. Kentucky has 856 family resource centers, all of which are school-based, and it is the second largest network in the country. So FRCs do vary in terms of the cost depending on the location, dependent on cost of living, specific to programming, and the physical space. A typical community-based New Jersey's Family Success Center has an annual budget of $240,000 to $300,000 with 3 to 4 full-time staff, whereas a school-based FRC in Kentucky has an annual budget of roughly $33,000 to $82,000 a year with 1 to 2 full-time staff, and space and other resources are provided in kind. FRCs are funded mostly by state, county, and municipal governments. Some have leveraged federal funding, such as community-based child abuse prevention. And some receive funding from foundations, corporations, individual donors, and in-kind support. Through the Families First Act, we were able to leverage FRCs to provide up to 12 months of in-home parent skill-based programs for parents or relatives caring for children who are candidates for foster care. So meaning here that in-home means that the child has not been removed from their family, not that the services need to be provided in their home. FRCs provide programs on the prevention services, the Family First Clearinghouse, such as the Incredible Years, Healthy Families America, Motivational Interviewing, Parents as Teachers, and Triple P. New Hampshire is the first state to leverage FRCs to implement kinship navigator programs. Networks of FRCs can support successful planning and implementation of Families First. Now, looking a level up, we talk about how family resource centers are connected. Not only have cities, counties, and states hit upon the value of FRCs, but they also hit upon the value of networking them together. Data from the national study that the NFSN worked on with a research institute in Colorado showed that the most common functions of Family Resource Center networks are increased connectedness, coordination, cooperation, and collaboration amongst members. They provide training and technical assistance to Family Resource Centers, work on advocacy, policy, and legislation that affects funding, and provide and maintain a shared data tracking system, again, as a method to showing this data to funders and showing the impact of Family Resource Centers. We talk about 3 stages of network development with Family Resource Center networks. First are emerging. It's when you're first just getting started, determining who's going to be at the table and what it is that you want to focus on. Moving to evolving after between 3 to 5 years. So as you continue to further develop, you might hire a contractor or your first staff, and the network begins to have more structure and capacity to do more. And then established networks we usually see with 5+ years of involvement. That's when you have staffing and a track record of activities. An interesting characteristic of these networks is that they have weathered crises and decided to stick together. We have seen 4 different types of networks emerge in the US. First are volunteer coordinated, led by FRC directors themselves in voluntary leadership positions without paid network staff. Examples include New Hampshire, West Virginia, Ohio, and Florida. We've seen funder-coordinated networks that are led by a public department or foundation that both funds and convenes the centers. Examples here include New York and Nevada. And a nonprofit coordinated network is usually with a nonprofit entity coordinating the network by providing backbone support with dedicated staffing. The nonprofit entity itself is not the network. The nonprofit may incubate the network to spin off in the future, or it may continue to coordinate it. Examples currently include Alaska, North Carolina, and Washington State. And finally, we see independent networks. It is a staffed independent nonprofit organization that functions as a membership alliance with members paying dues. These networks may raise and distribute funds, meaning that they're an intermediary, or not. Examples include Colorado and Maryland. The NFSN was co-founded by the 8 state networks of Family Resource Centers represented on this map. For the first 4 years of its existence, the NFSN had no paid staff, and the steering committee members coordinated the work of the NFSN as volunteers on top of their jobs of running these state networks that you see on the screen. Now, over the past 13 years, the NFSN has quadrupled in size to now have 42 member networks in 41 states and the District of Columbia that represent more than 3,000 family resource centers that serve more than 2,000 people annually. The newest member is Oregon, and then they joined in early 2025. The mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of the state Family Resource Center networks and championing quality family support and strengthening practices and policies. The vision is about turning that entire map green so that all families will have access to quality family support services in their communities provided by FRCs supported by strong networks. NFSN areas of work include connecting and convening member networks to enhance their effectiveness, increasing connectedness amongst the members for peer learning and mutual support. We promote family support, best practices, and evaluation. by raising awareness of what quality family support is and promoting a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And finally, we raise the visibility of the value and impact of FRCs and FRC networks in order to strengthen and increase support for families. There's membership network criteria that include 2 or more family resource centers are coming together. They can be at any stage of network development, and there's 1 network per state. So dues cover in whole state, regardless of the number of FRCs. The membership dues that you see reflected on this slide are going into effect on July 1st. And so this represents an increase that we haven't increased our dues in several years and represent other increases that we've seen with similar organizations across the country. If you are interested in, if you're thinking about joining and would like to secure lower rates than what you see, you are able to reach out to us, and we are always open for discussions. The standards of quality for family strengthening and support are designed to be used by all stakeholders, public departments, foundations, community-based organizations, and families as a tool for planning, providing, and assessing quality practice. They uniquely integrate and operationalize the principles of family support practice within the Strengthening Families approach and its research-based, evidence-informed 5 protective factors. They create common language and expectations across different kinds of family strengthening and support programs, such as family resource centers, home visiting programs, and child development programs. They help ensure that families are supported and strengthened through quality practice and are available for along with all implementation tools for free on the NFSN website. The standards are organized into 4 areas of practice with 15 standards, each with foundational and high-quality indicators and implementation examples. They focus on 4 core areas of practice: family-centeredness, family strengthening, community strengthening, and evaluation. Here we have some of our most recent standards training and certification that is happening in these states nationwide. As you can see, as of December 2024, we have trained over 18,000 people nationwide through the NFSN and our states that train. The NFSN worked with its members to develop a blueprint for how to scale family resource centers and family resource center networks to ensure that all families have access to quality family support and strengthening services. The NFSN publicly reports back on progress annually with a briefing event in May. Since the beginning, when the idea of starting the NFSN first emerged, the co-founders reached out to these organizations listed on the screen that offered their support. These include the U.S. Administration for Children, Youth, and Families, Casey Family Programs, the Center for the Study of Social Policy Strengthening Families, the Children's Trust Fund Alliance, Families Canada, Friends National Resource Center for Community-Based Child Abuse Prevention, and Prevent Child Abuse America. These partners regularly participate in NFSN activities, including serving on each other's committees, co-sponsoring events, presenting at events, and working collaboratively on joint projects. The NFSN works collaboratively with many other organizations as well. There are resources that are available to all of you on our Family Resource Center page of the NFSN website. That includes FRC overviews, videos, research reports, systems level funding information, and as well as a Webinar Wednesday library. We'll go over webinars a little bit later towards the end of the presentation, but there is a full webinar library that can be used as a resource as well. Again, this is available to anyone and everyone for free on our website. We have 2 hubs as well that we have developed. First, the Family Resource Center Learning Hub, also available on our website for free to everyone. This is a compilation of resources for those developing an individual FRC. So if you're thinking back to those beginning slides and thinking, okay, now you've seen them, you've maybe seen them in your state, but how is it that you start one? You can refer to the FRC Learning Hub on our website. And then we have the FRC Network Hub. This is a compilation of both NFSN templates and documents from member networks that can be used as examples for FRC networks and funders of FRCs. And I did want to mention that the FRC Learning Hub was developed with the support of Casey Family Programs. And again, you can access both of these hubs for free on the NFSM website. The FRC Network Hub is a compilation of both, again, NFSN templates and documents for member networks. So there's two sections. There's network tools for FRCs. So that includes sample of tools that networks would use for family resource centers, such as FRC identification surveys, FRC evaluation frameworks, and requests for proposals and those review tools. And then there's network tools for networks, samples of tools that networks would use to run a network, such as member agreements, network development continua, network job descriptions, and operating guidelines. We have resources for every state on our website that includes a member network snapshot. So this provides it's a snapshot in time of what that state network has going on. What are the quick data points of that network? How many FRCs do they have? When were they founded and how are they coordinated? And a snippet of information on what they're currently focusing on. Services from the NFSN include facilitating connections with NFSN member networks, presenting for key stakeholders, meaning education leaders, child welfare leaders, children's trust funds, and other public and private funders about working with and investing in family resource centers. We provide technical assistance for FRC network development and provide trainings, including the standard certification training, Connect with Effect and outreach training, and Parent Voices Matter, cultivating resilient parent advisory committees. So at this point, you all have received a lot of information on FRCs and FRC networks, and you've heard a lot from me. So I would love to see in the chat what resonates most with you from the information that's been shared so far? And what would you be interested to explore more? Let us know here in the chat. Give you some time to be able to review, think about that. Okay, getting some direct messages here about webinars, more information, absolutely in that webinar library, definitely. Let's see, more information about how FRCs are impacting my state and the value added benefit. Absolutely. So this looks like from a participant in Wyoming, which is one of our newest member networks. Definitely more information about FRCs. Yep, impacting. And let's see. Someone had said they're non-stigmatized because they provide services to all family. That's an awesome way of looking at it. Thank you. We absolutely do see it that way. Again, we believe that every family deserves support. That includes families that may be highly challenged or that may be affluent in affluent counties. Everyone deserves that support. And let's see, what time or what is the best way to get parents into the center? That is a really good question, and love that folks are thinking about how to incorporate parents and how to really invite parents and make sure that they can be at the, not only invite them to the table, make sure that they can be there. One thing that we have seen that we discuss often in the standards is putting out an ask to parents and finding out what works best for you. And maybe your parents in your community are third shift workers. So after they come home from work and or drop off their kids at school, maybe 8 to 9 a.m. is great. And maybe you have folks that are working more of a 9 to 5 time frame, or their parents that would love to get in a meeting right before they pick up their kids from school. Our our suggestion to you is to ask them. And my other suggestion is definitely to explore the resources that we have on the website, including the standards training overview that we'll talk a little bit about in just a bit here, for how to really, again, invite parents to the table. And we'll also talk about a training that we have for parent advisory committees. And let's see, and interested in the website that has every state and a description of what they're doing. Absolutely. So on the NFSN website, under members, you're able to click on the states and see a snapshot of those states. If they're newer networks, like Oregon, we may not have that one up just yet, but the majority of states are up there. And there's also key contacts for those states so that you can reach out to those network leaders. Perhaps they're in a state that has a focus similar to yours, or perhaps they're a neighboring state and you would like to know what your neighbors are doing and connect with them further. We encourage you to reach out to the network leaders along with the NFSN staff. We would love to engage with all of you. And Felipe has dropped that link into the chat as well. Oh, and someone shared as well that they give gift cards to encourage participation with parents, which we think is a great idea. Parents have a lot going on their plate, so any way to incentivize their participation is great. Gas gift cards, grocery gift cards, whatever works in your community that you see folks really enjoy. All right, this was an awesome buzz session. Thank you all so much for um, your discussion here. Again, encourage you to submit information into the Q&A as well, for us to be able to discuss at the end. I want to talk a little bit about the resources that are available to you all that are coming up with the NFSN that also would be good resources for some of the areas that you all have highlighted today. So we have a couple of webinar Wednesdays that are coming up here. 2 next month: strengthening mental health resilience for family support workers, and the return on investments of FRCs on April 16th. I encourage you, if you're looking at ways to find out what your state and other states are doing that would really speak to funders, especially, that return on investment webinar is going to be great. We also wanted to mention that with the webinar Wednesdays, we do have the webinar Wednesday library, as mentioned. If you are interested in a specific topic related to family resource centers across the gambit, let's say you're interested in how they work with community schools, you're interested in the response to the COVID-19 pandemic, you're interested in how family resource centers are co-located in library, school-based community resource centers, school or community resource centers that focus on working with fatherhood and fatherhood engagement, it is very likely that there is a webinar that relates to that topic. So take a look at nationalfamilysupportnetwork.org. You'll be able to find the registration link for these upcoming webinars, and you'll be able to find the recording and the materials for all past webinars, and they're separated. You can take a look at by FRCs, FRC networks, and there's a lot of network spotlights to where you can see certain states and what they're doing. That includes volunteer-led and independent networks, emerging, established, and those evolving networks as well. So we have standard certification training that is going to be offered in April. March is full, but we do have April that the NFSN hosts. You can find more registration information at the NFSN website linked here. And then you can also check the certification training page to see which network that might be in your state could be offering standard certification trainings as well. And the NFSN trainings are virtual trainings. For those of you who are interested in exploring parent voice more, we have Parent Voices Matter, cultivating resilient parent advisory committees. We do have a space left in our March training. You would have to register by tomorrow. Encourage you to visit the NFSM website to register by tomorrow for this month's training, or to take a look at the April date as well. As you can see here, 96% of participants report improved skills to successfully develop and sustain parent advisory committees. And these include models from Georgia, Texas, and Wisconsin to ensure broad relevance across different demographics. We also have Connect with Effect, which is an outreach training where you can learn how to understand outreach within the context of overall effective engagement of families, explore how to enhance outreach strategies, and develop an outreach plan. We are offering that training next month in April. You still have time to register, and encourage you to visit our website to take a look. Now, finally, want to give some time if there are any questions whatsoever for you all to be able to put your final questions in the chat before we end our time today. Again, today's webinar and its recording and all of its materials will be available on the NFSN website within 24 hours. And all of these resources, everything that's linked in this PowerPoint will be available to you. Thank you all so much. Again, let's see if there's any questions here. My contact information is on the screen here. We love hearing from you all. Would love to engage with you, whether you have a question, you would like to connect further. We love seeing you guys at these webinars and really appreciate your engaged participation. So that folks know, before you log off, once we end our time here, there is going to be an evaluation that comes up on your screen. We really appreciate you answering a few questions. We regularly look at our evaluations to see what topics folks will be interested in for future webinars, and also how we can improve this experience. So just like our FRCs, we're under a consistent period of evaluation and a loop so that we can know how to better serve the needs of our communities and our participants. Thank you so much to everyone who participated today. Take care.